gas around the gums, which we custom make for people. And we will do an ozone gas treatment to the gums, which is called an insufflation. And as we do that, we are running this ozone through a bottle of water, filtered water. And so that water is humidifying the gas, which makes it less drying for your gum tissue. But we're creating a bottle of highly ozonated water, which we then put into the unit and clean your teeth using an ultrasonic instrument with ozonated water in it. So now, as soon as you're done with your insufflation treatment, then we will clean your teeth with the Cavitron using the ozonated water. And the Cavitron is like using sound waves, vibrating the water. And the water is ozonated, and it's just being gently guided with the little slender tip under the gums wherever it needs to go. And the vibrations are cleaning stuff off of the roots, any bacteria, food, calculus that's stuck down there will be removed and flushed out of the pockets using ozonated water, which is at the same time highly oxygenating down there where the bacteria that don't like oxygen are living, and we're blowing oxygen down in there, and it kills them, and the water flushes them out of there, and you get nice, fresh, clean pockets, which now have a chance of healing. And the gum tissue, if it's kept clean, the gum tissue will re-adhere as much as it can to the root, and we will do this every 3 months and keep measuring and making sure that your pockets are not getting deeper and that they hopefully, in many cases, get shallower. And we want to try to get your gums from 7s, 6s, and 5s back to maybe mostly 4s and maybe 1 or 2 5s. If you had 7s, we may not be able to completely get rid of those. It depends on how much damage was done under there. The gum can only adhere back to the tooth so much, especially if you've already had root planing done. Then the root is not very good at accepting the little periodontal fibers anymore. So that's one of the reasons I'm not a big fan of the scraping of the roots, because that is, well, not only painful and needs anesthetic, but it does impair the surface of the root. It gets bacteria off of it, yes, cleans it, yes. But now the surface is different, and the periodontal ligament and gum tissue may not be able to re-adhere as well as it otherwise would have. So that is why I prefer to just do the Cavitron, clean everything up, and then try to get the gum tissue to heal. And we do this every 3 months, sometimes every 2 months, depending on the case. So that's how we treat the actual infection of periodontitis that happens in adults, and we will do the same treatment for juvenile periodontitis, although in that case, because it's so aggressive and severe, I generally want a specialist to be monitoring those severe cases. All right, today was about periodontics or gum disease. My name is Dr. Jessica Saepoff, and you're listening to Dental MD. If you have any questions, give us a call at the Issaquah office, 425-427-8899, or you can reach us by email, appointments@naturaldentist.com. Thank you for listening. I'll be back next week.
Over the rainbow, way up high, and the dreams that you dream of once in a lullaby.
The views expressed on this